callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the Ask the Experts show with local experts in the fields of legal, health, financial, and home improvement. Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, if you think this is weird for you, Ask the Experts coming on at 6 o'clock. It's really weird for me because our show for the last 6 years has always been 5 to 6. Well, now we're 6 to 7, not only on Thursdays, but on Mondays. So you got us to listen to on your ride home. And, you know, I've gotten some emails. People say, you know, I've been requesting a certain type of show, and you never do it. Well, you know, we stay pretty full, but we got so many emails asking. Some people would say, can you put a plastic surgeon on your show? Could you put a cosmetic surgeon on your show? It's the same thing. Well, we absolutely listen to our listeners. We got the finest plastic surgeon, I'm going to say in South Florida, because even if you're in Aventura, you will want to take the drive. And I just found out he lives where I live in Coral Springs. Let me introduce you to Dr. David Levins. How are you doing?
I'm doing
great. This is your first show.
I'm doing great. It's very nice to meet you, Steve.
It's going to be so much fun.
I'm real happy to be here.
How long have you been in practice?
30 years. I can't believe it. 30 years.
Wait a minute. No way.
Yeah, I started when I was a teenager. No. We started in 89. Yeah, 30
Did
years.
You really?
Yeah.
You know, so you went to MIT.
I went to
Are they still in business?
Yeah, they're still in business. Yeah, they're doing pretty good.
But how did you end up here?
Well, I went to MIT undergraduate, and I was a biology major, and I wanted to be a doctor. I had a high school biology teacher that said, you should go into medicine. And my parents, of course, my son, the doctor. It's a tradition.
Oh, yeah.
I don't care what kind of doctor you are. Yeah. And I went to Columbia for medical school, Columbia University in New York. And then I did my training at Montefiore Hospital in the Bronx, Montefiore Albert Einstein. It's a big teaching hospital in the Bronx. And then I went actually out to Los Angeles. I did a fellowship in hand surgery because I thought I might be interested in doing hand surgery. It's a specialty of plastics and ortho. It's a very intricate, it's an interesting specialty.
You have to do a fellowship in that.
And I did a fellowship. But lo and behold, I decided I didn't want to just do hand surgery. The reason we came back to Florida is because my wife's family is from Miami. So I'm from New York, Massachusetts. My wife's family is from Miami. And we said, let's see, which one should we do? And so we decided the Miami route, being our family. And we opened up a practice 30 years ago.
Wow. And I take it you don't do hand surgery at all?
I did some hand surgery in the beginning, but I haven't done it for a long time because one of the things that a professor told me is that if you just start doing one thing, then people think that's all you do. And I really had an interest in doing general plastic surgery, reconstructive, cosmetic, which we can talk about. But I started with a focus on hand surgery, but that was for the first couple of years, and now it's really mostly
I swear you're not going to believe this, but I actually knew a hand surgeon. That's all he did. His last name was Hand.
Oh, there you go.
In Dallas.
Perfect.
I mean, it was
perfect name.
Unbelievable.
Yeah.
But now the way you explained it, but he had a pretty big practice just with hand.
Yeah, a lot of injuries and that kind of thing. Yeah.
Yeah. So you came here to Florida.
Yes.
How'd you end up in Coral Springs?
So Coral Springs we came to because my wife's family is from Miami, and we looked at Miami, kind of crowded. Let's see where there's some growth up in that place called Broward County, which 30 years ago people didn't even know. There was farms, in Coral Springs. And then I also had a good friend from medical school that did dermatology. And so his dermatology practice was in Coral Springs.
Is he right across the street from you?
He was right near me.
Because there's a dermatologist.
Building. Yeah, he was right in the same building.
Okay.
And it's a nice kind of thing to feed you in the practice because people with skin cancers or whatnot, then they need to have it removed. The dermatologist refers to a plastic surgeon. So it was a good referral source for me. And plus my friend was there.
Well, you're right on the university. But here's something you've never heard me say before. I can't stand that people, something so big as plastic surgery, I mean, you're talking usually about looks, would find someone just by going to a website. I mean, I think you need to have some kind of referral, someone who's, That's why we have you on the show.
Absolutely. So I think, let me just clarify a few things. The term plastic in plastic surgery really comes from a Greek term which has to do with changeable, plastikos, or like the brain is moldable plastic. And then reconstructive is, of course, doing reconstructive surgery. So plastic and reconstructive is a whole encompassing field that does include cosmetic. It's what everyone seems to know about, breasts and tummy tucks and liposuction.
So is it broken or fractured?
Exactly. But reconstructive is the origins of plastic surgery, which really started more in traumatic injuries, war injuries, burns. That really was the origins of plastic surgery. That was really called reconstructive. But plastic is used more nowadays
What
for the
about cosmetic?
And cosmetic is something that I do mostly now. My practice is about 90% cosmetic.
So let's talk about your practice.
Sure.
Tell me the different you've got to do a lot of different services.
Right. Well, what I do mostly is I do a lot of breast surgery. So it's a lot of breast augmentation, breast lift, breast reduction, breast augmentation, which is implants, and lifting. Typically for a woman that has had the breasts get a little bit droopy, deflated, and then they need implants. And this is actually part of something that we just briefly talked about before, a so-called mommy makeover. It's a very popular term.
One of our listeners said to ask you.
Right. So what a mommy makeover is that the blessing of pregnancy and the blessing of having children, it can definitely affect the body, usually the breast and the abdomen. So the breast can get droopy and deflated, and the abdomen can get loose, the skin can get loose, the muscles can stretch, fat can redeposit. But it's really very variable because some women will have one child and have no problems. Others will have 4 children and have no problems. But so it really depends on how your pregnancy goes. But what we do with a mommy makeover is we'll work from head to toe, pretty much the breast area and the abdominal area.
All at the same time?
At the same time. Okay. It can be combined. In a healthy patient, you can combine the surgeries together and kind of get everything all over at once. The breast recovery is usually a lot quicker than the abdomen recovery. Abdomen or tummy tuck is usually a recovery that can take up to 6 weeks. But most people that are working, most women that are working, can be back to work at about 10 days to 2 weeks.
Oh, that's not bad.
Yeah, so 10 days to 2 weeks, but no vigorous exercise for about 6 weeks.
Okay. Now, first of all, we're talking about your practice. Give everybody your phone number.
Okay, so our phone number is 954-752-1020, and our website is www.drlevens.com.
Great website,
drlevens.com.
by the way.
Oh, thank you.
Give your webmaster. Yeah. And soon, today's show will be on there that you can go back and watch the show. One of the people asked, we had actually 3 people who knew about tonight's show. They wanted to know what services you do for men.
Well, actually, it's interesting because many people think that women are the only consumers of plastic surgery, but the truth is that my practice is probably about 15% men, and the most common surgical procedures for men are usually a procedure called gynecomastia. So gynecomastia, well, the term is man boobs,
okay,
if you want to use that term, but essentially what happens is that after a certain age or sometimes young, there can be some hormonal changes, and a man can develop some breast tissue that looks feminine, can be quite disturbing. There's a very straightforward procedure for that, a surgical procedure to correct the gynecomastia. So that's one condition. Another condition is just generally like liposuction can be done for a man as well. So just like a woman can have liposuction, men typically get areas of their love handles, the lower back and flank. Ideally, a person that has liposuction should be in pretty good shape. So this is an important question. It's not a cure for obesity. It's very important for a patient to be aware that liposuction is for diet-resistant fat. So hopefully they've already done all the right things, lost weight, been in shape, going to the gym, and they can't get rid of some stubborn areas, and that's where liposuction is a great procedure. So that's for men and women, different areas for men and women.
I got very discouraged when I went to the doctor. I wanted to have that done.
Liposuction?
Yeah.
Okay.
And they said my stomach is too hard.
Okay, so you have probably, or someone like you has something called intra-abdominal fat.
Okay.
And that's kind of a misconception that people have. When you remove fat, you're removing fat from the outside of the abdominal wall. So when you hold your stomach in, that's your muscles, and then it's the fat on the outside that you can get rid of. If there's fat on the inside, you don't want to be there with the cannula. So you want the patient to lose that weight, and if they can lose that weight and work on their abdominal wall tightness, then you can get rid of the the fat on the outside with liposuction. So,
Do you
so
do
perhaps
any other type of weight loss, like the?
Well, I don't do the weight loss surgery, but I operate on people that have had a weight loss procedure, and either they lose the weight on their own, and if they're very motivated to keep it off, that's usually a good sign. But there's something called bariatric surgery.
Right.
So bariatric surgery is done by specialized general surgeons that do essentially stomach restricting type procedures, where they close off portions of the stomach or the intestines, so that you're forced to lose weight because you really can't consume that much. Once a patient has been through that, they lose 50 pounds, 100 pounds, 150 pounds. It can be very dramatic, but there's usually a lot of loose skin. So that's where I come in and get involved in tightening the loose skin, like in the form of a tummy tuck or a breast lift or a thigh lift or an arm lift, essentially, right, cutting away the loose skin. Yeah.
Do men do the
Okay, so Botox. You're going to talk about injections, yes. So that's
the face.
Yeah, no, absolutely. So that's another. I just did a male facelift a few days ago. For facial rejuvenation, I like to try to divide it into face and body. So for the face, there are non-surgical approaches and there are surgical approaches. The non-surgical approaches are what you hear about injectables, very, very popular. You can go to any spa on the street or you can go to a plastic surgeon.
That's
of course,
shame.
my preference is you should go to a plastic surgeon that knows the anatomy, knows what's going on.
We went to a dentist. He was bragging, said, well, who's going to do it better? The face. That's what we... It was the biggest problem Renee ever had.
Yeah. No, it can be a problem if people just try to learn it very quickly and then do it. You have to have that experience. And then the other point that's important is being able to offer everything in that same area. In other words, someone has loose hanging skin, Botox and fillers are not going to work. You need a facelift. So if someone that can only offer Botox or fillers, Restylane, whatever, they might say, look, just fill up your face with this, when it's not a great option because they don't offer the other options. So that's where, when you go to a surgeon, then you can have non-surgical and surgical options.
So
For
when they
men,
come to you, they have a lot of different options.
Exactly. And for a man, absolutely, the lines on the forehead, and then, men in the workplace want to look younger, and injectables to fill out some areas of lines. And then skincare, we also have a med spa with where we do skincare. I have a licensed esthetician that does treatments,
laser hair removal,
micro needling, laser hair removal, peels, and that helps to complement. If I'm doing a facelift on someone, then they can get their skin taken care of, and then afterwards as well. So it's a nice complement to do the surgery and the non-surgical treatment.
Wow, there's a fast 15 minutes. We're going to go to break. You get to hear your commercial. We're here with Dr. Levens. His office is in Coral Springs, but let me tell you something. If you're in Palm Beach and you want someone you know is going to be good, it's going to be worth the drive for you. Give everybody your phone number.
Our phone number is 954-752-1020.
We're going to go to break. We'll be right back.
Dr. David Levens, certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levens can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levens has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levens' office today for a free consultation at 954-752-1020. That's 954-752-1020.
Yeah. Hey, we're back. I'm sitting here. We're talking to Dr. Levens. He is our new, can I just call you a cosmetic surgeon?
Yeah, that'll be fine.
He's our new cosmetic surgeon, and man, I just think so much of what you do because you actually change people's lives.
Absolutely. Yeah, it's very rewarding to have people feel better after a procedure. I'd like to just clarify that thing, and you said cosmetic, which is totally fine because cosmetic is what I do most of the time. But I do some reconstructive surgery, and my history is with reconstructive surgery. And what I was going to say is that I still do take care of some skin cancer patients and breast cancer patients. And some of the most rewarding patients are the patients that really need your services, not to take away from people that just want your services but don't really have a physical problem with them.
Right.
So that's essentially the difference between cosmetic is you're trying to make something better that's not broken. When something's broken because they have breast cancer, they've removed their breast, or they have skin cancer, that's reconstruction. So reconstruction versus sort of cosmetic. But I do both, and most plastic surgeons come up through that. Sometimes when you have someone that's just a quote-unquote cosmetic surgeon, they've not necessarily come up through that whole training, that whole
Right.
board certification, long training, and then they take maybe a weekend course. This could be someone that's like a medical doctor, literally, that then learns how to do these things from just some online education and not going through an entire residency. So just to
I'm
clarify
glad
that,
you did explain that.
Yeah.
Some of the letters the 3 letters we got, one of them wanted to know, and it was breast augmentation.
Mm-hmm.
Is it painful, and how much work will I miss?
Okay. Well, breast augmentation is probably the #1 procedure in the country. Not very painful at all. We use a lot of local anesthetic, and then typically we'll prescribe a pain pill that someone might take 1 or 2 or 3 at the most.
So you're awake during this?
Well, no. So let's talk about the different types of anesthesia. Local anesthetic is utilized to help supplement whatever is done for sedation.
Okay.
So I always do my procedures with at least some degree of sedation. I prefer to have an anesthesia provider involved, either an MD anesthesiologist or a certified registered nurse anesthetist. They place an IV. They start some medication, some sleeping medication like propofol, and they may use an inhalation agent. That's what's called general anesthesia. But typically, if we can do it with just called twilight, it's kind of like when through a colonoscopy. Okay, so it's a very pleasant experience. But that's a 5-minute procedure. This is an hour procedure.
Is that how long it is?
It takes about an hour to do a breast augmentation. So you have to be monitored. And we use a lot of local anesthetic in the area that's long-lasting. So when you wake up, you don't really have a lot of pain. And most people are back to work within a few days.
Wow, that's amazing.
Yeah, for sure. I mean, as far as really vigorous activity, serious chest exercises, probably more like a few weeks, but definitely back to work in just a few days.
I got to ask you about eyes, too. I don't
Okay.
want to forget that. Do
Okay.
you work? The reason why I ask it is in some of our markets, we have, in our other cities, we have doctors that all they do are eyes.
Okay, so-
but they call themselves a plastic surgeon.
No, so let's clarify that. There's a crossover, okay, and you can have an ophthalmologist, which clearly is a doctor of the eye, but then you can have a retinal specialist that's the back of the eye. You can have a corneal specialist that's the front of the eye for cataracts and that kind of thing. And then you can have a plastic or oculoplastic specialist that takes care of the lids.
Okay.
Now, I take care of lids because that's part and parcel of basic plastic surgery, but it also could be this specialist ophthalmologist, which is called an oculoplastic surgeon. So I do that type of surgery as
So
well.
there's doctors that do just lids.
There are people that just do that. Absolutely, yes.
But
yes.
they call themselves a plastic surgeon.
Well, but they use the term plastic because plastic has to do with changing and molding, and it has the whole cosmetic connotation, which is, it has to do with changing.
Okay.
And so you're changing either something that's already normal. I mean, someone's eyelids that are a little bit droopy is really normal. Someone's eyelid that's been ripped away by an accident or by cancer, that's abnormal.
Right.
So there's a reconstructive component and a cosmetic component. But it's just important to realize that you should have the ability to do both if you're dabbling in cosmetics.
Every one of my mother's sisters, all 5 of them, had rhinoplasty. Mm-hmm. But I don't hear of people having that done as much as you used to.
That's a so-called nose job, or
Yes.
rhinoplasty. And it's not quite as popular as breast surgery. I've done a number in my day. I'm actually not doing that anymore because I've kind of decided that I want to focus on certain areas that I do all the time. And I can tell you that rhinoplasty is one of the most complicated surgeries that's
Is it
done.
really?
Absolutely.
I should know.
To
I
get-
watch Botched.
To get a perfect result, yes. And it's right there in the center of your face. It can be very technically challenging. And so, I mean, if you're doing lots and lots of them, good for you. But at some point in my career, I just decided I was not going to be doing that and focus on things that I do all the time, and I get really good results. So,
What's the newest thing that you're doing?
well, for me, it's actually just kind of embracing the non-surgical. And so many of our patients start with something non-surgical, such as injections.
See if that works first.
Yeah, well, Botox, fillers, and then the skincare. And then for someone that's 30, 40, they may not need to have that facelift or that eyelid surgery. There are things, for example, with the eyelid that I have the problem myself, but you can fill in underneath here. It's a non-surgical eyelid procedure where you can use a filler in the office and get an immediate improvement in the lower lid without surgery. Now, that might last for a while, and the patient might like that, and then after a while, they say, let's go do the surgical procedure. So I think embracing the non-surgical is something that's definitely happened, and you can see that the numbers of non-surgical procedures have definitely skyrocketed, and the surgical procedures are there, but they've kind of leveled out. That's not to say that I'm going to stop doing surgery, but it's just it's a nice option to have.
You work on lips?
I do work on lips, yes. We do injections for lips, filling lips, and have to try to make them look good, keep them in balance.
I think that's one of the hardest things to do, because I got to tell you, I've seen,
You've seen some bad
women.
ones?
I don't know if they're bad.
Well,
but
if it stands out as something unusual, that's what people say. Now, I know that we're doing this show in Boca, my practice in Coral Springs, but what you hear all the time is you hear about, I don't want to look like one of those Boca people. Okay, so there are bad-looking people in Boca, there are bad-looking people in Coral Springs, but what happens is when someone has something overdone and it becomes too obvious, to me, in my opinion, it's not proper.
It does, yes.
So I think it should look natural, it should look refreshed, it should look like what did you do? You change your hair, you look good. That's a compliment of good plastic surgery, is when it looks good.
What do you do when you have a patient that wants it
overdone?
Yeah.
That's a really good question.
You know it's not going to look
Well, that's
good.
a really good question. So what happens is that people get that because they insist, and they find a doctor that's willing to do that. And if the doctor that started is not willing to do that, they'll find another doctor. Like you said, there's a doctor in every corner. So I try to keep my own aesthetic in mind, and I sometimes push it a little bit if someone wants. But actually, the thing about lips that's interesting is most people, when you talk about doing their lips right away, they said, I don't want to have duck lips, or I don't want to look like one of those weird people. They want to have something nice and natural. And then,
So they
a little bit.
trust you for the size.
Aesthetic judgment, and we do a lot of photography. Digital photography is so easy.
So you
we
can actually show them.
Well, we take pictures right away, and then we show them images of what they might look like and what other people's similar lips look like, and then they can get an idea, like, I like that, I don't like that. And it's always very important, too, to document, because, when patients come back after a treatment and they say, hey, what's this over here? And you have to remind them that was there before. We're trying to correct it, but we can't correct something that was there before, possibly. So, they assume that you did something wrong sometimes when you have to show that it might be something, a flaw that they had.
Your work is advertised.
Yes.
Every day.
Yes. Yes.
And people are always going to go, wow.
Yes.
And that's really what you want.
Yes. Yes.
That's amazing. I had someone ask me, and I already know the answer to this now. You don't do hair, do you?
I do not do hair replacement.
See,
I did
I
a little
think
bit in the
you're
beginning, but you have to have a specialty in that. I think that's the type of thing that you should do all the time. You shouldn't just dabble in it, because it's critical to get it right and to get it natural. And so there are centers that do that, and there are some plastic surgery colleagues that I have that really focus on it, but I do not do that, no.
You know what? I like the way you do your practice, because since I see plastic surgeons, cosmetic reconstructive surgeons, and you look at the list of their services and you go, how can they be good
at
at everything?
Exactly right. Exactly right.
It's like the attorney, the shingles.
Right.
They do everything.
Right.
And if
it helps you to specialize a little bit, it helps the patient for sure.
It does.
To specialize a little bit.
I mean, and if you look at all of our attorneys on here, they specialize in one area. So I like the way you do your practice. And you know what? If you've been thinking about this, and there's a lot of, it's a shame insurance doesn't cover a lot of stuff.
Well, actually, they do cover certain things. So they cover, like I said, reconstructive, okay? A mastectomy. That's mandated that someone is able to have their insurance, if they have insurance, to cover the reconstruction. A skin cancer, an accident, things like that insurance does cover it. One of the kind of the two sort of borderline things are breast reduction, okay? And frankly, there are plenty of plastic surgeons that still do breast reduction through insurance. If you're plagued by very heavy breasts, back pain problems, there's got to be a lot of documentation, and not every insurance company will allow that to be an exception. And we used to do that, and we would do that, and people are very appreciative. When we do breast reductions now for cash, self-pay, people are still very appreciative because they feel better, they look better.
Right.
But the other thing would be noses. When there's like a deviated septum,
like breathing
an accident,
or something.
And so some people say, okay, we'll fix the nose and make it look better too. Well, the making it look better is not really for insurance; it's more for cosmetic. So it kind of gets a little bit borderline there. But
Well, before we leave, I'm going to ask you something, and I want to just be totally honest. Why should I come to you?
well, I think that this gets to the point that you were asking about before. How do people find you? And the important thing is, well, I would start with a reference. So if you have a doctor that you trust, a family member, a friend that you trust, ask them who they would recommend. The next thing is looking up credentials. And if you look up at the credentials and you can see if someone's board certified, they've been in practice for a long time, they have good reviews, even a couple bad reviews. Everyone has a couple bad reviews,
Yeah, but some of those aren't real either.
mostly good reviews, exactly. And then their results. Look at their before and after gallery. And for me personally, I think that I do a pretty good job. I've been doing it a long time. I have a lot of happy patients, and I'm happy to see anyone.
The confidence is overflowing. You can tell. Listen, I am so glad we have you as part of the show. It's Dr. David Levens. Again, his practice is in my part of the country, Coral Springs, but listen, you know what? Isn't it nice to know that you can go someone, even if you live in Palm Beach, someone that you know that you can trust, and, you know, give him a call tomorrow. You have consultations.
Yes, we do. Free consultations.
Free consultations. Yes. People can come in, and that's the first start. Dr. Levens will be with us again next month. We'll be promoting that and tell you when he'll be in. We're going to go to break, and when we come back, we have more of Ask the Experts. Thanks, Dr. Levens.
Thank you.
Dr. David Levens, certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levens can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levens has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levens' office today for a free consultation at 954-752-1020. That's 954-752-1020.